Hello there, everyone. Welcome to On the Virtual Sofa with Metta Health. And today I'm so excited to tell you that we have got consultant bariatric surgeon, Mr. Andrew Jenkinson. Really excited to be interviewing Mr. Jenkinson, and you are going to see why very shortly. So, Mr. Jenkinson, thank you so much for coming to see us today.
Pleasure to be talking to you, Giselle.
Thank you. So tell us a little bit about yourself, just so that the audience can learn about you.
So I'm a consultant surgeon, and I specialise in bariatrics, so that's surgery for weight loss. But I also specialise in surgery for hernias, gallstones and acid reflux disease. But the bulk of my work is bariatrics, so weight loss surgery and medical treatment. I've got 30 years experience as a consultant. I've trained in all of the top teaching hospitals in London, including doing my thesis at the Royal London, working at the Hammersmith Hospital, and now I'm a senior consultant surgeon at University College London Hospital. Privately, I work out of the London Clinic, where I direct bariatrics, and also the new wonderful Cleveland Clinic London, which overlooks the Queen's Gardens, or the King's Gardens now. Done lots and lots of research, trained lots of surgeons around the world. I also do a clinic in the UAE. Love my job, love helping patients, whatever condition they've got, but particularly, weight problems, because these people, get really good outcomes and get a new life after the intervention.
Really fascinating. So we really want to find out more about what you do. So tell us what non-surgical and surgical minimally invasive treatments that you offer for bariatric care.
So if someone comes to me who's been struggling with their weight, and people tend to have struggled with their weight for years and years, sometimes decades, dieting, losing weight, putting weight back on, and they come to sort of the end of the road and they want some sort of intervention. Okay. The non-surgical is these new injection drug treatments. So I think they're called a number of names. So the one that we prescribe at the moment is called semaglutide or Ozempic. But there are other ones. The new one coming online in the UK is called Wegovy. Internationally, you may have heard of Mounjaro. So these are what we call GLP-1 hormonal treatments that work on the brain to switch off your appetite, improve the way your insulin works, and they produce about 15% of your weight loss. Okay, 15%. So imagine, calculate right now, take off 15%. That's where you'd be in about 6 months. It's only a once weekly injection. It's pretty low risk. It's hardly any risk at all. If the dose is too high, you feel unpleasantly nauseous for a few hours, but pretty low risk. Most people tolerate these treatments. The downside is when you come off the treatment, you tend to put weight back on. Also, they cost around about £120. So this is like $140, $50 US per month. So that's another downside. So that's a nice, safe intervention as far as sort of non-surgical. I don't offer things that I don't think work. So the gastric balloon, I don't think works. The endoscopic stapling, I don't think it works. I think it's quite dangerous. And all these other sort of interventions, I don't offer. So the only non-medical one I offer is the one that works, with the injections. As far as surgery is concerned, it is life-changing. It's pretty safe. And the two main operations are either the sleeve gastrectomy, where we remove 2/3 of the stomach, or the gastric bypass, where we bypass the stomach. Bypass is split up into two different types of bypass: the traditional Roux-en-Y type of bypass, which is good for reflux. But then the other one, the newer one, is called the mini gastric bypass, which is actually even more powerful than the gastric bypass. So these, and as I said, they're pretty low risk. Risk of serious complication requiring a longer stay in hospital is about 3%. The operations take around about an hour only to do. And people would tend to stay in hospital just for one night. Because it's keyhole surgery, like small little cuts, 5 small little cuts just below the rib cage. It's not too painful. So literally one night in hospital, all being well. If you're busy and you do have a job in the office, you can be back in the office in about a week. When I see the patients a year down the line from bariatric surgery, I don't recognize them when they come in. It's literally, they're a different person. They may have gone from, for instance, 120 kilograms to 70, 75 kilograms. All of those, problems that I've been struggling with for years have gone away. So the operation's a brilliant, brilliant way, a pretty safe way to just change your life around. A lot of people are a little bit worried about, are they going to be able to still enjoy food after these operations? You can enjoy food. You can go out with friends and family and socialize and just enjoy food, communally. But you're not going to be able to eat a load of food fast, which you don't really want to do anyway. And you won't actually have the urge to do it because these operations do change, the messages between your stomach and the appetite center in your brain. So they're really, really good, effective, and pretty safe operations, actually, Giselle.
Right, thank you. That is absolutely fascinating. Just to think that someone can go from 120, is it 120 kilograms?
Yeah.
To 77 kilograms with one of these operations.
Yeah, 70 to 75 usually. Yeah.
That's incredible. Also really interesting to hear about the injections for people who'd rather not have surgery. Just for the benefit of the listeners, I wonder if we can take a couple of seconds to kind of discuss if someone is coming from overseas and wanted to have the injections, how would that work?
So they would normally be triaged or checked by your office that they're going to be suitable for the injection treatment. I would consult with them, and I can do that remotely via Zoom or in my office in Harley Street. And then if they're suitable for the treatment, I'll explain, that we normally titrate the dose up slowly. So we go from low dose for a month, then medium dose for a month. Then if they need a higher dose, we would sort of put them on the higher dose for the third month. But I would write a prescription in that first consultation. If they want to take a large supply of the drugs home, that's fine. They can do that. They can purchase them from the pharmacy. The thing about the drugs, if you are traveling with them, you'd obviously need the prescription to prove that they've been prescribed, but also you need to keep them in a cold box, ice box on the journey back.
Okay, thank you very much. And I have to say, that was kind of an unplanned question. I thought Mr. Jenkinson handled that extremely well, and it's really informative.
Yeah.
So thank you so much for that. So can we just recap on what sort of outcomes that you get for patients?
Yeah. So for the bariatric surgery, so the operations that I mentioned, so the sleeve gastrectomy and the gastric bypasses, basically they're all really effective. So for instance, if you're 120 kilograms and you have a sleeve, then probably you're going to settle at between 75 to 80 kilograms probably. The slightly more powerful one is a Roman gastric bypass. That's better for diabetics. So again, if you're 120 kilograms, it's a little bit more powerful than the sleeve. So you might settle at 70 to 75 kilograms. And then the most powerful one is the mini gastric bypass. Again, really good for diabetics, good for people with blood pressure, even people who are really quite big. So for instance, if you're 150, 60, 70 kilograms, you can still have the mini gastric bypass. And that's going to produce the best weight loss of all of them. As far as risk is concerned, I mentioned before, there's about a 3% risk that you might get some problem, meaning that you need to stay in hospital for longer. But if you get a problem, we can sort it out. We've got the whole professional team and all the allied sort of professional services that are needed in the hospital.
Thank you very much. And you operate out of the London clinic as well, don't you?
So both the London clinic and Cleveland Clinic London, yeah.
Yes, excellent. Okay, thank you for that. So tell us, Mr. Jenkinson, when you think about your career and all that you've accomplished, what are you most proud of?
It's definitely the recent book that I wrote and published with Penguin, became a 70 times bestseller. It's called Why We Eat Too Much, and it basically explains weight regulation. It was inspired actually by all these patients coming to see me who tried to lose weight, and I was thinking, there must be something that we don't understand, because why is dieting and exercise so difficult? Why does the weight always come back on? So it basically explains, I think quite eloquently, weight regulation, these nuances of different things like leptin resistance, lots of changes in the appetite. So the book's, as I say, 70 times bestseller, been translated into Korean, Mandarin, Arabic, Italian, Russian, Estonian, Ukrainian, so lots of different languages. So I'm pretty proud of that. And I'm in the process of finishing the second book, which is going to be called How to Eat and Still Lose Weight. And that's going to be looking at reward pathways, the dangers of ultra-processed foods, and, how to cook.
Excellent. So When can we look forward to that? When is that going to be out?
That's going to be out January 2024. So, yeah, still working on it, but the manuscript's almost off to Penguin.
Can I just say, Mr. Jenkinson has very kindly sent me copies of his first book, Why We Eat Too Much. And I've started reading it and it's absolutely riveting. I'm going to read you just a little excerpt from the introduction. It says, realizing that each of my patients was telling me virtually the same story before surgery and that they had become different people after surgery, I started to wonder whether what they, the patients, were saying was correct and what we, the doctors, were saying was wrong. Whether our conventional understanding of obesity was flawed. Was this a condition that arose in patients without them having any control over its development? In other words, was it more of a disease than a lifestyle choice? I wanted to answer these questions. So please, if you know anyone who's struggling with obesity, or if you are yourself, this is a must read. Please do pick it up, order it. I think it's available on Amazon. So please do order it and you will be fascinated. What I absolutely loved about it was the empathy, the compassion, and with which it was written. So I would highly recommend it. Mr. Jenkinson, thank you so much for being on the virtual sofa with us today.
Thank you, Giselle. It's been a pleasure. Absolute pleasure. Fantastic.
Excellent. One of the things that I'd like to say is that we're hopefully going to be doing a webinar together.
Yes, looking forward to it.
Bariatric surgery, and we are looking forward to it. So look out for the details of that, because I think it is going to be an exciting webinar indeed. Thank you once again, Mr. Jenkinson. And
thank you, Giselle.
Thank you, and we look forward to seeing everyone soon. Thanks for joining us today. Bye now. Bye.